Welcome back, everybody, to Living 808. Sister Joan Chatfield has specific daily duties, both with her convent and the community.
Yeah, that's right. Those duties were becoming harder and harder to perform. And Sister Joan, despite some fear, decided to get some help from the vein clinics of Hawaii.
I have so much to do, and I believe in what I do, that I didn't want to be slowed down to the point where I couldn't do it. I knew something was wrong, and that's enough to hold me back and make me think first before I acted, and that was the real issue.
We're at Vein Clinics of Hawaii. We're talking about a procedure fairly new for varicose veins and various other conditions. One of the persons that's had the relief from this procedure is Sister Joan Chatfield. Thank you so much for being with us on Living 808. I appreciate it. Now, we're going to talk to your doctor, Julif, in just a moment. But first, I want to know what life was like before you had this treatment.
Well, you know, this kind of thing is you have a gradual realization that you can't do what you used to do. Mm-hmm. And you have a gradual realization that then gets to the point of you better do something about it. And I had a condition called lymphedema, and at the time I didn't even talk veins, I just thought lymph. And it wasn't until I didn't get much satisfaction there that someone said, you know, you better go and look at the vein thing too, because maybe it's both and, not either or.
What brought you to Dr. Julif?
A recommendation of one of the local doctors here, Dr. Cyril Goshima, who is my internist, also my former student. I taught him in high school, so I deserve everything he gives me.
Good morning, Joan.
Oh, good morning, Doctor.
When I first met Joan, it was obvious by her symptoms as well as by her examination that she had problems with vein function. And that's something that we call venous insufficiency. It has to do with the blood going in the wrong direction. But her main symptom was swelling. And she had pretty severe swelling that was really interrupting her ability to accomplish her activities of daily living. And we treated her. The treatment that she had primarily was something that we call endovenous ablation. And that is to use a catheter that's threaded into the vein in a painless sort of fashion, and it heat treats the inside of the vein and corrects the problem of the vein function. It took the place of old-fashioned surgical vein stripping. People much more prefer endovenous ablation, the newer technique, because of the much less discomfort and downtime. Some of our patients also require a little more help because they have ropey veins of the legs. Joan didn't necessarily have a lot of that, but for that we do something called microphlebectomy, which is to actually remove those bulgy veins from the leg.
How is it for you going through the whole process, the procedure?
I didn't lose a minute's work except for the time I was in the office. I mean, I had the procedure, walked out. First 2 times I think I had to drive down, but the rest of the time I drove myself and I drove myself home. I want to tell people, if it's the right procedure for you, don't be afraid. I think fear keeps a lot of people from coming in and getting it even checked out.
So you're finished with the procedure. What was it like?
Mostly it meant that I wasn't constrained by wanting almost to sit down instead of stand up, or go to places that I didn't have to walk a lot. I mean, I saw my activity coming back. I saw my flexibility coming back, which was nice.
You have important work to do, and a lot of people are affected by what you do. Tell me about the sisterhood at Maryknoll.
Well, I came to Hawaii when I was 23. Now I'm 85, so you figure I've met a lot of people in the way. I live in a house with 3 other Maryknoll sisters, one of whom is going to celebrate her 95th birthday and has been compromised with a pelvic fracture 3 years ago. So I'm pretty much her factotum. I drive her around, and I had to have a little deal with God. And so I say to God, if you want me to take care of Sister Rosario, you better help me take care of me in the process. And this was a part of that process.
Important stuff.
Mm.
Helping patients like Joan is particularly rewarding because a lot of our patients come with cosmetic kind of complaints. With her, it was a real functional problem for her that really impacted her daily life. So to be able to fix that for a patient like Joan is just so tremendously rewarding. more so than many other types of medicine that I have practiced even in the past.
I think it's given me another lease, you know, I think we all come on the globe temporarily. Nobody lives forever. So here I am at 85 saying, well, I'm not going to close it down at 85. I think I've got a few more years to go. And this helps. It helps.
I love that she asked for help, she got the help she needed, and she is such a big part of not just her convent, but the community. So the Vein Clinics of Hawaii did that for her. I think that's an amazing job they did.
Very nice story with a happy ending.
Yes.
And I think the lesson too here is, you know, a lot of people live with varicose veins, and, you know, a lot of people know that it may be unsightly to look at,
Sure.
but it can also lead to long-term health problems. So you really need to get that taken care of.
And she herself admitted that there was some fear because of the old procedure, which would go in and it would actually be surgery, would have to take the veins out.
It was very invasive, but now they have these non-invasive procedures. You know, you should at least look into it.
Yeah.
For sure.
Yeah, that was a good story. All right, coming up on Living 808, we all know fruits are supposed to be a part of our diet.